Visits to ERS will be allowed daily from 1 p.m. to 6 p.m. PPE must continue to be worn indoors at all times and social distancing maintained between different social bubbles. Visits must be booked in advance. These will be increased to 2 designated visitors per resident per day. Only 1 visitor will be allowed at any given time when the visit is conducted indoors, with 2 allowed outdoors. They will require a negative antigen lateral flow test on the respective ERS site prior to their visit. All visitors must provide proof of receipt of 1 dose of a COVID-19 vaccination. Non-vaccinated visitors will be allowed to visit in external communal areas. Bella Vista Day Centre and the respite services will return to full capacity. As regards Inverness Hospital, visits remain limited to 2 named designated visitors per inpatient for the duration of their hospital stay. Only 1 of the designated visitors will be allowed during the allocated visiting hours per day. Designated visitors are strongly urged to have been vaccinated with at least 1 dose of the COVID-19 vaccine 14 days previously. Those unable to receive the vaccine will now be able to visit wearing full personal protective equipment and following a negative lateral flow test before entering. PPE for visitors will be provided at the entrance of all wards where they will have your test. They must also keep a distance of 2 metres from the patient. Visitors who have received their first vaccine dose but wish to visit earlier than the 14 days gap required must also wear full PPE. Those who have returned from international travel from countries with a quarantine period will not be allowed to visit the hospital until the isolation period has finished and they've had a negative swab test.